Welcome, friends, to the World Story Channel. I am your narrator, Rames. Enjoy listening to the full history of medicine. Do not forget to write your opinion in the comments, and we will proceed. In the shadow of spirits and ancestors, tens of thousands of years ago, illness was a mystery woven into the fabric of the spiritual world. In the flickering light of a cave fire, a shaman would dance and chant over a tribesman writhing in fever. The cause was not a virus or a bacteria, but an evil spirit, a sorcerer's curse, or the wrath of a displeased ancestor. The healer's tools were incantations, amulets, and the empirical knowledge of plants gathered over millennia like willow bark, a natural source of salicin, the precursor to aspirin. The most striking evidence of their daring is trepanation, the deliberate drilling or scraping of a hole into the living human skull. Whether to release a demon causing headaches or epilepsy, or to relieve pressure after a head injury, this brutal procedure was performed. Astonishingly, many survived, as skulls with clear signs of bone healing around the opening attest. This was the dawn of medicine, a potent mix of magic and early, brutal, practical intervention. To the ancient civilizations, from ritual to system. As great civilizations arose, medicine began to structure itself. In ancient Egypt, life depended on the Nile's canals, and the human body was seen as a similar system of channels. The vital force K flowed through them, and illness was a blockage or the work of a demon. Medical papyri, like the Ebers Papyrus, reveal a surprisingly advanced system. There were specialist physicians for the stomach, eyes, and teeth. They practiced detailed diagnosis, palpation, and used a vast pharmacopoeia: honey as an antiseptic, castor oil as a laxative, and copper for cleaning wounds. They sutured injuries and even crafted primitive dental bridges. In ancient India, Ayurveda, the science of life, was born. It was based on balancing three vital energies or doshas: Vata, air; Pitta, fire; and Kapha, earth. The physician Sushruta, author of the Sushruta Samhita, was a master surgeon. He described over 120 surgical instruments, scalpels, forceps, needles, and his pinnacle achievement was rhinoplasty, the reconstruction of a nose. Using skin grafted from the forehead, he restored the features of those whose noses were amputated as punishment. In ancient China, medicine was built on the concepts of yin and yang, and the flow of vital energy, qi, through meridians. Illness was an imbalance or a blockage. Diagnosis centered on the pulse, with physicians distinguishing hundreds of variations. To restore harmony, they used acupuncture, inserting fine needles into specific points on the body. Herbal medicine was equally sophisticated. The plant Artemisia annua, for instance, was used to treat malaria millennia before the Nobel Prize was awarded for the discovery of its active compound, artemisinin. The Antique Revolution, the birth of scientific thought. The true intellectual revolution occurred in ancient Greece. Here, medicine was separated from religion. Hippocrates of Kos proclaimed that every disease had a natural cause, to be found in diet, lifestyle, and environment. In his work, On the Sacred Disease, about epilepsy, he boldly stated it was no more divine than any other. He established the humoral theory, which would dominate for 2,000 years. Health was a balance of 4 bodily fluids: blood, phlegm, yellow bile, and black bile. This theory gave rise to treatments like bloodletting, a practice that would ironically cause suffering for centuries. But Hippocrates' greatest legacy was ethics, the Hippocratic Oath, which laid the foundation for medical morality. The Romans, great engineers, applied these ideas practically. The physician Galen, who worked with gladiators, gained immense surgical experience. Later, as the emperor's doctor, he conducted numerous animal experiments. He proved arteries carried blood, not air, by tying them off and showing the pulse vanish downstream. He detailed the nervous system by severing nerves and observing paralysis. Galen created a grand, comprehensive medical system. His authority became so absolute that for 1,500 years, to question him was heresy, ultimately stalling medical progress. But the Middle Ages, a schism in development. With the fall of Rome, Europe entered the Dark Ages. Medicine retreated into monasteries. Monks preserved ancient texts. But human dissection was forbidden. Disease was again seen as divine punishment, and treatment involved prayer, penance, and relics. Surgery was deemed a lowly craft, left to barber surgeons who performed bloodletting and amputations. Meanwhile, the Islamic world experienced a golden age. Caliphs sponsored the translation of works by Hippocrates, Galen, and Sushruta into Arabic. The physician and philosopher Avicenna, Ibn Sina, compiled his monumental Canon of Medicine, a 5-volume encyclopedia that systematized all existing knowledge. It became the primary medical textbook in both the East and West for 500 years. Another genius, Al-Razi, Rhazes, left a precise clinical description differentiating smallpox from measles. The surgeon Al-Zahrawi, Abul Qasis, created an illustrated treatise detailing hundreds of instruments, the principles of which are still in use today. The Renaissance, challenging the ghost of Galen. In the 14th to 16th centuries, Europe reawakened. The first and most formidable authority to be challenged was Galen. A young anatomist, Andreas Vesalius, working at the University of Padua, did the unthinkable. He performed human dissections himself. What he saw did not match Galen's descriptions. He realized Galen, forbidden from dissecting humans, had described animal anatomy. In 1543, the same year as Copernicus's revolutionary work, Vesalius published his masterpiece, On the Fabric of the Human Body. It was a work of art and science, with stunningly detailed anatomical illustrations. He corrected about 200 of Galen's errors. The scientific truth was met with hostility. Colleagues hounded him, calling him Vesanus, madman. He eventually burned his manuscripts and left medicine, but the door to inquiry had been forced open. Simultaneously, the iconoclast Paracelsus worked. He publicly burned the Canon of Avicenna, declaring that even a shoemaker knew more about his trade than physicians knew about the human body. He proclaimed the body was a chemical laboratory, and illness a chemical imbalance. He began using simple compounds of mercury, lead, and arsenic for treatment, laying the groundwork for iatrochemistry and modern pharmacology. In the 17th, 18th centuries, from form to function. If Vesalius showed how the body was built, the English physician William Harvey discovered how it worked. Using experiment and calculation, not just anatomy, he studied the heart. He demonstrated that in 1 hour, the heart pumps a volume of blood greater than a person's entire body weight. This proved blood was not consumed by the organs, but circulated. In 1628, he published his work describing blood circulation, dealing a mortal blow to Galen's humoral theory. At the same time, the invention of the microscope revealed a new world. The Dutchman Antony van Leeuwenhoek, with his handmade powerful lenses, peered into a drop of water and saw animalcules, microorganisms, red blood cells, and sperm. Humanity had glimpsed its tiniest and deadliest foes. The century ended with medicine's first clear victory over a major disease. The English doctor Edward Jenner noticed that milkmaids who contracted the mild cowpox never suffered from the deadly smallpox. On May 14th, 1796, he inoculated a boy, James Phipps, with matter from a cowpox sore. He later exposed the boy to smallpox, and he remained healthy. Vaccination, from Latin vacca cow, was born. It was a triumph of reason over fear. In the 19th century, the triumph of the scientific method. The 19th century was the era when medicine became a true science, defined by 3 monumental revolutions. 1. The anesthesia revolution. Before 1846, surgery was hell. Operations were conducted on conscious, restrained patients. On October 16th, 1846, dentist William Morton publicly demonstrated the use of ether anesthesia at Massachusetts General Hospital. A tumor was removed from a patient's neck without a scream. The era of surgical pain was over. 2. The antisepsis revolution. Even successful operations often ended in death from gangrene, or hospital fever, sepsis. The Hungarian doctor Ignaz Semmelweis, working in a maternity ward in 1847, discovered that the death rate was far higher in a division staffed by doctors who came directly from autopsies. He mandated hand washing with chlorinated lime. Mortality plummeted from 18% to 2%. He was ridiculed, fired, and eventually died in an asylum, ironically from the very sepsis he fought. His work was continued by the British surgeon Joseph Lister. Inspired by Louis Pasteur's germ theory, Lister reasoned that wound infection was also caused by microbes. In 1865, he began treating wounds and spraying the air with carbolic acid, phenol. Post-amputation mortality rates crashed. Antisepsis was born. 3. The microbiological revolution. The French chemist Louis Pasteur proved that microbes did not spontaneously generate, but came from the environment. He developed pasteurization. His greatest contribution was creating vaccines in the laboratory, weakening pathogens for chicken cholera and anthrax. In 1885, he saved a boy bitten by a rabid dog with his rabies vaccine. The German physician Robert Koch went further. He formulated Koch's postulates, a strict set of rules to definitively identify the cause of a disease. Following them, he hunted down and identified the bacilli of anthrax, the dreaded tuberculosis, in 1882, and cholera. At the century's end, Wilhelm Conrad Röntgen gave doctors X-ray vision, allowing them to see inside the living body without a scalpel. The 20th century, the century of miracles and new challenges. The 20th century began with Paul Ehrlich's concept of a magic bullet, culminating in Salvarsan, the first effective chemical treatment for syphilis, and the birth of chemotherapy. But the century's most transformative discovery was penicillin. In 1928, Alexander Fleming noticed that a mold, Penicillium, had contaminated a petri dish and killed the surrounding bacteria. A decade later, Howard Florey and Ernst Chain turned this observation into a life-saving drug, mass-producing it just in time for World War II, where it saved countless lives. The antibiotic era had begun. Parallel breakthroughs occurred in endocrinology. In 1921, Frederick Banting and Charles Best, in a hot Toronto lab, isolated insulin from the pancreas of dogs. Diabetes was transformed from a death sentence into a manageable condition. The mid-century gave us the most important biological discovery of all. In 1953, James Watson and Francis Crick deciphered the structure of DNA. Medicine had descended to the molecular level. Technology gave doctors new eyes. The 1970s saw the arrival of the CT and MRI scanners, revealing the intricate details of the brain and soft tissues. Surgery achieved the impossible. In 1967, Christian Barnard stunned the world by transplanting a human heart. On the threshold of the future today, we live in the era of molecular and personalized medicine. The Human Genome Project allows us to read our own biological blueprint, enabling drugs to be tailored to an individual's genetic profile. Cancer immunotherapy doesn't poison the tumor. It trains the patient's own immune cells to recognize and destroy cancer. Gene editing, CRISPR-Cas9, offers the potential to correct hereditary diseases by rewriting faulty DNA code. Artificial intelligence analyzes medical images with superhuman accuracy and aids in diagnosis and drug discovery. The history of medicine is a grand narrative, from the shaman's rattle to the genetic scalpel. It is a story of stubborn dogma and brilliant insight, of tragedy and triumph. It is the story of humanity's relentless struggle to understand its own body, to fight suffering, and to claim the right to life and health. And this journey is far from over.